Good afternoon, ladies and gentlemen. Today we're going to be talking to you about an issue that has been featured a lot recently in the mainstream media over the last few years. Now you may be asking, what issue are they going to be talking about? Could it be the highly publicized antics of Justin Bieber? No, but we can't mention him simply because based on his actions over the last few years, we all can assume he's recently suffered a blow to the head. Anyways, we're more or less going to be focusing on concussions and the recent developments around player safety regarding concussions. Now, we all know concussions have been highlighted a lot recently in major sports such as hockey, simply because of the high frequency of contact within the sport, which can unfortunately lead to high-paced impacts towards the head. Also, player safety hasn't really been as regulated as it is now towards concussions. When we look back on players from decades past, we can see that concussions were more of a nuisance rather than a serious injury. So as a former hockey player, playing junior B and at the collegiate level with the Laurier Golden Hawks, did you as a player ever experience a concussion?
Yes, once in junior B and once in the university level. One in a game and one in a practice at the university. It was a practice, and we were doing a power play penalty kill practice session, and I was coming from behind the net around to the front of the net to try and do a jam play, and my defenseman that was covering on the penalty kill hit me with his forearm, and I was knocked out. The trainer was out there. He just was checking my faculties to make sure that I was conscious, and asked me how I felt, asked me how many numbers he held up. But I was just escorted to the bench, and practice resumed, and I was just left there with the trainer. He kept asking me questions, and I just said that I was fine. And
Did you miss any game time or anything?
No, I had a hockey game the next night, and I played in it, and never missed a practice or a game as a result of that.
So do you feel the training staff did an adequate job based on the information they had at the time, or do you think they could have done a better job?
No, I think they did what they knew about concussion at that time. It's certainly a lot different than it is today, and the knowledge that we have about head injuries and so forth has developed through the last 20-25 years, so that now we're more aware of it, but certainly not back then when I was playing.
But also as a player, even, I'm sure you've had your bell rung before, but as a player you obviously just sort of played through it,
Yes,
back then you now know is not what you should be doing.
That happened to me in my first junior B game in Oshawa. I was knocked out. I was receiving a suicide pass, and it was around center ice, and I was knocked out completely, and went to the bench, and it was in like the second period, but I sat the second period, but I played in the third period, and at that time, you're just playing your first junior B game, and you want to make the team, you want to impress, so you're certainly not thinking about concussion or head injuries.
Yeah,
you just want to get back in.
The player's mentality of getting back into the game.
Yeah.
From that interview, Nolan and I came to the conclusion that it wasn't truly the fault of the trainers at the time for allowing players to go back and play. A lot of the weight was really placed on the players self-assessing themselves and probably returning before they should have. There were no doctors there assessing them and being like, yes, they should or they shouldn't return to play. It was the players saying, yeah, I feel good, I'm going to go back in. So me and Nolan decided to go talk to Brock's athletic therapist and see what some of the procedures, both past and present, that are used to assess somebody who may have a suspected concussion.
Well, my name is Joe Kenny. I'm the head athletic therapist here. I've been here since 1981 in this position, so about 32 years. And over that time, I guess I've seen quite a few concussions, and the awareness of concussion in the last probably 2 years or 3 years has been really important in helping students, especially who are participating in sports, because in the past they weren't certainly recognized, and now they're being recognized and they're being dealt with probably much more effectively. So that's where we are right now.
Have you found any differences in the past 2 or 3 years, like you said, of actually the protocol of assessing and
yes, I mean, Dr. Patch, we think first. If you go on the website, think thinkfirst.ca, it shows you the steps that we use, the 6 steps to return to play. And pretty well that's accepted by most people across the province of Ontario. One of the nice things now, McGill University has done a really good thing. They've taken individual sport and they've developed return to play protocols for them too. So for example, the general Think First protocol is good for all sports, but it says, okay, then return to sport-specific activities. It's better if we can give you a sheet of paper for basketball or for rugby or for soccer or for hockey and say, okay, these are the activities I want you to do non-contact. You know, specifically you can do ball dribbling, you can do stick handling, you can do skating, you can't do contact yet.
Okay.
And same thing on the basketball court. So, you know, if your friends want to look at return to play criteria that's specific to a sport, they can simply just go on McGill. One of the nice things now, McGill University has done a really good thing. They've taken individual sport and they've developed return to play protocols for them too. So for example, the general Think First protocol is good for all sports, but it says, okay, then return to sport-specific activities. It's better if we can give you a sheet of paper for basketball or for rugby or for soccer or for hockey and say, okay, these are the activities I want you to do non-contact. You know, specifically you can do ball dribbling, you can do stick handling, you can do skating, you can't do contact yet.
Okay.
And same thing on the basketball court. So, you know, if your friends want to look at return to play criteria that's specific to a sport, they can simply just go on McGill. I have a couple I'll give you when you leave here, so you can take a look at them too. So they're a little bit more specific than the Think First, but the Think First website is probably the best that I've seen so far.
Okay, perfect. And all BRAC therapists follow this protocol then?
We hope they do.
Most often they do?
Well, yeah, the biggest challenge with the students is recognizing, with anybody, is recognizing when a person has concussion.
Right.
Because quite often the students, they're pretty young and they feel invincible and they want to play and they're not thinking too much long term.
Right. One of the
After our talk with Dr. Kennedy, we went to the McGill website as he suggested to look at this document in front of you, which is the Think First Sport Smart Concussion Education and Awareness Program. Looking through it, one can see it's a very detailed publishing about concussions. It talks about what they are, how to detect signs and symptoms in players suspected to have a concussion, as well as return to play protocols for coaches and trainers to follow to allow those players to properly return to play. If you look recently, you can see that there have been a lot of drastic changes to rules and regulations within leagues that govern concussion protocols. If you look at the NHL, they actually have doctors on site ready to assess players with concussions and pull them out of the game to prevent any further injury. What about minor hockey players? Most of the teams I grew up with didn't have a doctor on site. Most of the time it was the parents just saying, how many fingers? And if you passed, you could go back in. And that's why Nolan and myself believe that information such as the Think First Sport Smart Concussion Education and Awareness Program need to be applied to the minor ranks of sport to increase player awareness. Because the majority of these young players will not make it to the professional level, it's not worth them causing such harm to their bodies, which may have long-term effects. Therefore, concussion protocols need to be taught and applied at the minor level to prevent any players from finishing their sport careers with any type of neurological damage. And if you look at minor hockey leagues across Canada, that's exactly what's beginning to unfold. To leave you with a quote from the Ontario Minor Hockey Association website, "The OMHA and Hockey Canada are serious about working with administrators, coaches, trainers, officials, parents, and players to create the fun, respectful environment we all expect in the game. The rule changes combined with education, awareness, strong player development, and respect for the game will reduce injuries such as concussions to help keep the game fun for all." As horrible as it may seem, I know I probably played a couple of games of my minor hockey career with concussion. And who knows what the long-term effects of those injuries may be. But, you know, you look at it, and I'm a fourth-year university student, so they may not have been, what's the word I'm looking for? Sorry, I'm having trouble putting my thinkings into words. I can't speak right now, but I am smart. Wait, what were we talking about again?